My name is Leslie Lozano Delgado, and I am the Outreach and Engagement Manager at HealthNet Health Center. I would like to share a little bit of information about Community HealthNet. Community HealthNet is a non-for-profit, federal qualified health center committed to provide quality, accessible, and affordable healthcare for our community. Community HealthNet has 7 locations in the area. I just want to share that information with you all. We have locations in Gary, Hammond, Maryville. Community Health Net has a lot of different programs. Our primary services are medical, dental, vision, but we also do a lot of different activities. Each month, Community Health Net observes different health and wellness awareness campaigns that align with our priorities for improving health across our patients and our community. This week is very special to us. From May 9th to the 16th, we are celebrating National Women's Health Week. And why we do this? CHN celebrates these campaigns, and in this case, this Women's Health Week, because we strongly believe that these health awareness campaigns help raise awareness of important health issues and stimulate patients to seek information and services. And we also like to share information with them. Today, we have one of our awesome therapists from Community HealthNet that is here to talk about nutrition and mental health for women. So please help me welcome Ms. Alicia McWilliams. She's here to share some information with us. Thank you. Hi, Ms. Alicia. Thank you for joining us today.
Thank you so much for having me today, Leslie. It's a pleasure to be here.
Thank you. Thank you. I want to say thank you for accepting to talk to us about nutrition and mental health. I know this is your area of expertise. And I would like to know if you can please give us a little bit more information about the connection between nutrition and mental health.
Yes, Leslie, there's been extensive research that shows that the way we eat affects the way we feel. So diets high in fat and processed foods actually contribute to depression. They've even been shown to worsen symptoms of depression. In fact, there was a 2017 study done where there were 67 participants that were diagnosed with major depressive disorder, and they were split in 2 different groups. One group ate a Mediterranean diet, and the other group ate the American diet that we typically see in America, high-fat processed foods. And at the conclusion of 12 weeks, the group that were eating the Mediterranean diet actually saw a reduction in their depression symptoms, which concludes that what we eat matters, and it ultimately affects our mood and the way we feel.
Oh, definitely. I agree with you on that what we eat really matters. Mm-hmm. Can you tell us about your personal journey to understanding nutrition?
Yes, absolutely, Leslie. I grew up in a family that was very loving, but we did not have the greatest dietary habits. So I was similar to the people in the study. I ate a lot of processed foods growing up, fattening foods, and overall, I just didn't understand nutrition. At a young age, I saw several family members actually pass away due to illnesses related to their diet, essentially high blood pressure, diabetes, all different illnesses that were contributed to by their dietary habits, and many actually passed away pretty young. So that was eye-opening for me at a young age, but I still didn't have the information, the knowledge to make changes at that time.
Wow. I totally understand. Mm-hmm. Let us know then, what was your motivation to lose weight?
Well, 2 years ago, Leslie, I myself was actually diagnosed with hypertension. So I had several weeks where I was here at work at HealthNet, and I felt dizzy at work, and I ignored it for a period of time, just kind of blowing it off. One day I got so dizzy that I ended up actually going to the urgent care after work, and that's when they took my blood pressure, and I was diagnosed with hypertension that day. My blood pressure was about 150/96, and so I had been walking around with high blood pressure for God knows how long, and it was eye-opening to me. And like I said, in that moment, I really started reminiscing all of my family members who had died from preventable illnesses that were related to their diet. And that day, moving forward, I made changes and I never looked back.
Wow. That was a really eye-opening, definitely. Thank you very much for sharing that information with us. Let us know a little bit what dietary changes you did that help you lose weight.
I would say one of the main things I did, Leslie, was cutting out processed foods. So for your listeners, the main way to identify processed foods when you're in the grocery store is any foods that if you look at the ingredients and they include more than 5 to 7 ingredients, you're likely eating processed foods. So I largely eliminated that. Every once in a while, I have a cheat meal, but my base diet does not include processed foods. And yeah, I just pretty much learned how to eat. I joined a fitness program that included a meal plan, and from that, it was eye-opening to me how different the foods were compared to what I was typically eating on a day-to-day basis. And I still eat carbohydrates. So a healthy carb would maybe be like brown rice or couscous or quinoa, as opposed to French fries. And I also stick with lean proteins, like your 93% ground turkey, chicken breast, lean fish, and that's pretty much what my diet looks like today. And pretty much any produce, any green vegetables too.
Wow, okay, that's very interesting, Can you let us know how do you measure your food? Because that's very important also, and sometimes it's a little bit hard. Can you let us know how you do this so we are make sure that we're not overeating?
Absolutely, Leslie. Portion control is huge. I'm going to say that even when in the past when I was eating healthier food, I was trying to eat healthy. I realized now looking back, I was still overeating. So I was probably eating 2 or 3 serving sizes of rice as opposed to just one serving size. So the best way to go about making sure you're eating the correct serving size, I encourage everyone to buy a food scale. And you can go on Amazon and get a food scale for about $13, but a food scale pretty much allows you to eat the exact serving size. So you can adjust the scale and say, okay, I want to measure all my food in grams or ounces. So then you can actually make sure you're eating exactly 5 ounces of chicken breast or 4 ounces of ground turkey, or in my case, brown rice is one of my other favorite foods, 70 grams of brown rice. So you're eating the exact serving sizes on the package as opposed to kind of just eating whim like most of us are accustomed to doing. But as a result, we typically will overeat when we're doing that.
That's true. And you know what? That's new to me. I haven't heard about the scale, but that's pretty interesting. I'm definitely will look into that. Thank you very much for sharing that information with us. I would like to know if you have any extra tips that you would like to share with us.
Absolutely, absolutely. I was going to just say once again, the way we eat affects the way we feel, so it affects our mood. I just want to introduce your audience to something called mindful eating. So the idea of mindful eating is just simply to pay attention to how you feel when you eat and what you eat. I would even encourage them to get a food journal. So just get a journal and kind of jot down what you're eating on a daily basis. That would even be beneficial in the process of calorie counting to make sure you're eating within a certain calorie amount for those that's trying to lose weight or even maintain their weight. So yeah, just being aware of what you're eating during the day. The food journal to me is an excellent idea because like I said, I feel like so many of us, we just eat and we indulge and we're really not even certain of what we eat. So how can we make changes that we're not aware of what we need to make changes?
Definitely.
Absolutely.
That's true. That's true.
Yeah.
Wow. Well, again, thank you very much for sharing this important information with us. I have a question in regards to any of our patients or anyone from our community are interested to get in contact with you. How can they get in contact or schedule an appointment with you?
Absolutely. They can call the main community HealthNet number, which is 219-880-1190. You can also reach me directly here at OSC or the Ophelia Steen Center at 219-321-9385. They can also email me. My email is amcwilliams, so AMCWILLIAMS at CHN-Indiana.org.
Awesome. Well, thank you very much for sharing that information. Again, I'm going to repeat that number. Our main number here at Community HealthNet is 219-880-1190. If you have any questions about mental health, nutrition, please give us a call, schedule an appointment. We have awesome therapists that will be able to help you. Thank you again, Ms. Alicia, for talking to us and sharing this great information with our audience. Thank you.
Thank you for having me, Leslie. Thank you.
You're welcome. Bye-bye.
Bye-bye.
These are trying times, and many are struggling to literally put food on the table. Do you worry about how you'll afford groceries? Community HealthNet has an answer and the resources to assist you with this. If you are age 60 and older and are income eligible, Community HealthNet can help you and your family. Call us today at 219-880-1190 and we can set you up at one of our 6 convenient Community HealthNet locations.